Case numbers are on the rise, deaths are on the rise. Locally and across the South Plains, officials are struggling to get people to follow the simple guidelines of wearing your mask, socially distancing, and with no gatherings over 10. Now, joining us now are Grace Morris. Grace, talk to me about what the definition is for a recovered person.
Well, Terry, the CDC says that after you've tested positive for COVID-19, it's safe to be around other people if it's been 10 days since your first symptoms, and if you've been fever-free for 24 hours, and your other symptoms are improving. But that doesn't mean that you aren't still experiencing some symptoms that will last longer.
That's very true. We've seen some people get very mild colds and hardly any symptoms, and you've seen some people on the opposite end of the spectrum. It goes from one end to the other. Now, what are some of those long-term symptoms that we can see?
Yeah, Terry, so like we said, some people can recover from COVID-19, but some still experience those long-term effects, most commonly including fatigue, cough, and chest pain. But others have reported things like depression, heart palpitations, or even intermittent fevers. The more serious complications being things like heart inflammation, abnormal lung function, or even hair loss.
That's scary.
Yeah.
The lingering effects that it can cause. Now, Grace, talk to me about, once you've recovered, what does immunity look like, and does it last?
Well, it's possible to get reinfected with COVID-19. The CDC is saying that antibodies typically last around 3 months. And after that time period, it is possible to get reinfected with COVID-19 again, which is just another reason that local officials are urging people to follow those guidelines, especially during this upcoming holiday season.
For sure.
This is not wearing a mask.
Our hospitals are full, our ICUs are full, our emergency rooms are full.
Local officials from Lubbock to Plainview are pleading with the public.
Our surge in cases is not due to super spreader events, but it's the accumulation of thousands of decisions that are made across the community to ignore public health guidance.
Trying to impress the seriousness of COVID-19 across the South Plains.
It's heartbreaking sometimes. It's depressing sometimes. We go in here and we're trying to do all these things, and we're doing all these things that we're trying to do, and then the numbers keep climbing up.
But the governor's saying there won't be another shutdown, and Mayor Pope says Lubbock will continue forward with the current plans in place.
We will make decisions based on facts, not on fear. We'll remain flexible, and we will stay the course with our effort.
Yet deaths in Lubbock and Hale County have been high. Hale County reporting 6 deaths Monday, while Lubbock reporting an all-time high of 18 deaths in a single day. According to the Lubbock COVID-19 dashboard, out of the 325 people who have died from COVID-19, just over half have been male and a majority have been white. Most of the deaths have been in the 80 to 89 age range, but almost no age range is unaffected.
I mean, we mourn each and every death, each and every one, and I sympathize with families and have compassion for them. I wish there was something I could do.
And with the holiday season approaching, officials warning folks not to put their life or someone else's in danger.
We have to think long term. We can't think short term. We can't think of what we want to do today. We have to think what's best for us long term.
And it seems to be all about personal responsibility. Dr. Ron Cook asking everyone to think about their Thanksgiving plans and change them to make them as safe as possible. Only have 10 people at your house, and make sure you're doing those simple things like washing your hands, wearing your mask, and social distancing, as those are still 3 of the best tools that we have. Terry?